I was just having an interesting conversation with Dr. Gupta from ANP Ankle and Foot Clinic. Great to see you.
Same here.
We were just talking about how there are so many, a million or more hip replacements every year. Astonishing number, but you have a way that people can actually avoid that later in life.
Yes, there's, there are more than 1 million or so knee and hip replacements combined.
Okay.
Most of these knee and hip replacements are done because of the excessive wear and tear on the knee joints and the hip joints, and that's the ultimate answer to that.
Sure.
Most of this excessive wear and tear starts with a person's foot.
The foundation, right?
The foundation, and one of the very common problem is where in the foot, the first metatarsal is first of all maybe sitting a little bit higher compared to the rest of the metatarsals, and the other part of this is the joint between the metatarsal and the cuneiform is very flexible.
Okay.
So as the person stands on that foot, this bone continues to move up and the foot continues to roll in.
Basically your feet will go
basically
in.
Your foot looks like you have a flat foot. As the foot flattens, it also causes the knee to internally rotate. So the leg wants to rotate internally because the foot is carrying it, and the thigh wants to stay more straight, which causes a twisting of the knee joint.
That sounds ridiculously uncomfortable. It does.
And with thousands of steps a day over the number of years, that knee joint wears out. The cartilage in the knee joint wears out as much as the knee joint can handle. The rest moves on up to the hip joint, and the hip joint goes through the same type of motion and causes excessive wear and tear on the joints. So if somebody may have worn out their knee joint at the age of 70, now they're wearing it out at 50 and needing that knee replacement a lot sooner than later.
Well, lots of adults, I mean, if you're an adult and you're going to know if you're walking like that on your feet, but it starts way earlier than that.
Yes, it starts with the childhood. As soon as the child starts to walk, you're going to see some of that. But first 4, 5, 6 years of age, the child is going to go through a normal balancing act of their body because they're still learning to walk properly and efficiently. But past that age, if you see the child happens to have a flat foot or complaining of foot pain, ankle pain, leg pain, shin splints, even hip or back pain after activity, then there's something wrong. There's something going on. Feet are not supposed to hurt. The legs are not supposed to hurt under normal circumstances. If there's pain, there's something wrong. And this is one of the problems that I have seen over the years that is very, very common.
So what can you do for someone with this problem?
Well, first of all, if we can start early enough, we can start with custom-made functional arch supports or orthotics to balance the foot and restrict and control some of this motion. And we talk about custom-made arch supports, not custom-fitted arch supports. It's just like if you're going to get glasses. You don't go to the eye doctor and they don't bring out your glasses from the back room. Your eyes are measured, your accommodations are measured, and the glasses are made for you. That's what we do, is to make these arch supports for individual foot, not just for your feet. Even your 2 feet can be different. So each arch support is actually made for each foot.
All right, and where are you located?
We're located at 6053 Southeast 14th Street. We also have an office in Indianola. And so we split time between 2 offices.
Well, it was great to meet you, and thank you for all that information.
Thank you.